The WHO Collaborative Center is a research unit of the University of Verona. It was established in 1987 with the mission of supporting research in the area of mental health in favor of vulnerable populations living in low and middle income countries, but also of vulnerable population resettled in high income countries. After more than 30 years of activity, the WHO Center now is involved in three main research areas. First, we support the WHO headquarters in Geneva to develop and implement evidence-based recommendations that the WHO then uses to scale up treatment and care for people with mental health conditions in low and middle income countries. Second, we support the WHO in keeping the WHO list of essential medicines updated. We are responsible for the chapter dealing with mental health conditions. And third, we test by means of randomized controlled trials the efficacy of interventions, psychological interventions developed by the WHO to support vulnerable populations, including asylum seekers, refugees, migrants, and people exposed to the traumatic experiences related to the COVID-19 pandemic period. Over the last few years, the WHO Center published hundreds of scientific publications reporting the results of these research activities.
The Redefine project was focused on the evaluation of effectiveness and cost-effectiveness of Self-Help Plus, a new psychological intervention developed by the World Health Organization that was used for preventing mental disorders in asylum seekers and refugees living in Western European countries and in Turkey. We found a strong and significant improvement in the prevention of mental disorders at 6-month follow-up. That was our primary outcome in Turkey, while in Western Europe this effect was stronger at immediate post-intervention. The innovation of Redefine is the aim of preventing mental disorders instead of treating already developed mental conditions according to a public mental health approach.
The Respond project is a project funded by the European Commission and which involves University of Verona, the WHO Collaborating Center of the university and other universities in Europe. The first aim of this project is to identify the vulnerable population for psychological effect due by COVID-19 pandemic. And after identifying this vulnerable population, the project aims to support this population, offering an intervention developed by WHO. In the first line, a very simple intervention called Doing What Matters in Time of Stress. And then, if further support is needed, another step intervention called Problem Management Plus. This is known as a step intervention program. Here in Verona, the vulnerable population identified is the migrants, and so this project is for all people in Verona, not Italian, with a particular focus on non-Italian students of the University of Verona.